Referrals are very important in family medicine because you are managing and contracting a lot of patients, and you should know how to do a referral. Objective: first, you need to define what is a referral, what are the elements of the referral letter, general reasons for the referral, factors that influences the referral, and monitoring the referral. Definition of a referral. What do you think? Why would we need a referral?
It could be emergency situation and we cannot handle it in the primary center.
Okay, any emergency situation that requires probably a little bit of advanced thing, which is not under the scope of primary physician. Yes. Okay. Anything else?
If the patient need to do advanced tests, not
Okay, good, good. All right. So if a patient needs advanced tests, all right. Comments from the female side. Why would we need a referral?
Ask for second opinion.
Asking for a second opinion. Okay, so referrals could be of different types and could be of different reasons. So when you are referring a patient, you should know why you are referring it and what you are referring. If you're making a referral letter, the referral letter should have name, a medical record of the patient, address, age, presenting complaint, history of presenting complaint, a bit of that, bit of past medical history if it is relevant, medications, social history. This is all if it is relevant or if it requires, if it is needed in the referral letter. If not, then you can just skip that. Allergies, physical examination. Okay, the patient presented to us with this problems. We have done this. On examination, we feel that. And investigations, we have done these investigations. What we are provisionally diagnosing is this, and why we need a reason for referral. So that the referee who's attending this patient should know that, okay, this has been done to you as a physician, and you require opinion regarding only that specific issue. And if there is any specific information or services needed from the specialist. General reasons why we need a referral. We need a referral for reassuring the diagnosis. We can refer it for the investigations as mentioned. For special treatment, if some requires insulin and the insulin is not available, or if someone requires some phototherapy and the phototherapy is not available, and things like that. Or if you think that the patient requires surgery, like if the patient is have hernias and he requires some surgery, so you can you can take an opinion for the operation, for taking over, so that if the patient is, so if you are dealing a patient who has who is planned for hernia, and but his sugars are very high, so the surgeon has actually referred you to control the sugars before we go on to the surgery. So once the sugars are controlled, now you can refer back to the patient that his sugars are controlled. Now you can go on for a thing or anything like that, taking over. For reassurance of the patient is not very comfortable with you treating, so you can, for the reassurance, you can take a second opinion. And for reassurance of the doctor, as a doctor, maybe you are not very comfortable with the diagnosis, so you want a second opinion as a doctor, or you want to make sure that I am going in the right direction or not. So that is also important. Sometimes there are over or under referrals, incorrect labeling, and collusions of the anonymities. So you don't know which, there is a similarity, there is somatic fixations, there is de-skilling of the GP. So because the GP is very much is not very skilled to treat the patients, so he may do some over referrals or he may do some under referrals. So probably the patient is having some chest pain, which is cardiac in origin, and he thinks that he can manage it on its own. So it's actually under referral. Or if the patient has some musculoskeletal problem and he refers the patient to a rheumatologist for seeking opinion for the rheumatoid arthritis, although it's not clinically fitting the diagnosis, so it's actually an over referral. So skills are very important. Maybe deprive the patients of the benefits. Sometimes the patients are being deprived with these benefits. Sometimes the deterioration of the patient's condition. So by doing over and under referral, you probably may ended up depriving the patients. You probably may ended up deteriorating the patient's condition and lose touch with the medical developments. So you need to properly refer the patient in order to get the maximum benefit. There are factors involved in it. One is the doctor's factor. Probably the doctor is not very confident. Probably the doctor does not have a good clinical skills to do that. Probably he does not have good resources to do that. He does not have any investigations and present in the primary healthcare. So probably he would like to refer the patient. Sometimes it is from the patient. The patient wants a referral and to take an opinion from an endocrinologist and so on and so forth. The patient is not satisfied. Sometimes your system wants you to do that. For instance, that there is a system probably when you are not required as a physician to diagnose diabetes or to start the treatment of the diabetes, you have to take the opinion of the endocrinologist first. So here is because of the system, you need to seek an evidence or advice from the endocrinologist. So system related factors. And there are other factors also. Sometimes there are time related issues. Sometimes there are other miscellaneous factors. Monitoring of the referral is also very important. What is an appropriate referral? An appropriate referral is where it should be, where you know why the reason why you are referring the patient, what actually you're required to for the referrals. And you also need to know the referral rate. Okay, this doctor sees 20 patients or 50 patients and refers 2-3 patients. Some doctors are seeing 50 patients and referring 50% of the patient. So if the referral rate is high, then you need to know why the referral rate is high. And if the referral rate is very low, even then it's a concern that why it is the referral rate is so low. Although there is no right and wrong, but you need to monitor it in order to see the pattern and see the factors so that these factors can be addressed. Sometimes sometimes the referral rate has become very high, and then you see the reasons for referral. It is because of some CBC that is required. So that's very important to know the referral rate. And then feedback. All right, sorry. So feedback is also very important, whether the feedback from the patient, feedback from the person who you refer to, and feedback from the physician. And there are other forms of referral. So referral is important in this way. You know the exact exact cause of the referral. And now I will go to, all right, the second part. Uh, uh, Referrals of the common conditions. Referral for the common conditions are, yani, if you see, when you come across with the different conditions, you should know what is the limitation in the family medicine. So if, for instance, if you say cough, so what could be the referral criteria for evaluating a patient with cough? Or I can say, the danger signs of the cough, because whenever there is a danger sign, you think that there is a problem and you need some specialty input. So what is the danger sign in the cough?
If it's associated with blood, like hemoptysis.
Yes, okay. Hemoptysis, number one.
Weight loss.
Yes, weight loss. Good. So the cough is a very, yani, it starts off with a very benign thing, like you have runny nose, or you have just allergic cough, and going up towards the malignancy. So you need to be very careful while you are dealing with cough, whether does it have this danger signs present or not. If the danger signs are present, you need to refer the patient. So any symptom that you are reading or any topic that you are reading, you should know what are the danger signs and when are you going to refer that patient. For the cough, it is weight loss, night sweats, hemoptysis, maybe history of asbestosis or pleural effusion, and stridor, hoarseness, superior vena cava syndromes like swelling of the neck, if the cough is greater than 3 weeks. So these are all danger signs in the cough. And when you read the topic, and there is in the Oxford GP, it's also written that these are the danger signs that you should be very careful. Okay, tonsillitis. What you think that what could be the danger sign for the tonsillitis?
And number of recurrence.
Number of recurrence. Okay, why?
To exclude rheumatic heart disease.
Yeah,
Fever.
rheumatic fever. Okay, yes, this is the one sequely, so you need to be very careful about that. Or you need a referral. There's a referral criteria for recurrent tonsillitis, and you should know the referral criteria. So if the patient is falling on that referral criteria, you should actually refer the patient for the tonsillitis. So tonsillitis is a very simple thing, but if it is recurrent and persistent, you need to take the referral. And what else in tonsillitis?
If there is shortness of breath or obstructed.
Yes. So if the tonsillitis is causing shortness of breath or airway obstruction, that's one thing.
Or dysphagia.
Oh, dysphagia. That's great. So things like that. Whenever you're anything else that you could think of as you guys have done your ENT rotation?
Strider, doctor.
Strider. Okay. Yeah. Um, Unilateral tonsillar enlargement. Okay. Quincy. These are all danger signs that can think you of that. Okay, this tonsillitis is not just tonsillitis; it has something underlying with it. So you need to detect those problems, and so that you can appropriately take the referral. Dyspepsia, it's a simple thing for dyspepsia. What could be the danger signs in dyspepsia which could lead you towards anything severe? What is the danger sign in dyspepsia? You know what dyspepsia is, right? Yes. Danger signs in the dyspepsia.
Esophageal cancer, doctor.
Okay, esophageal cancer, but what could be the symptoms of dysphagia which could point towards esophageal cancer maybe?
Severe abdominal pain or esophageal pain.
Weight loss.
Weight loss, generally speaking. So, okay, to start off with the danger signs, weight loss can fit into, I will give you some tip. Weight loss fits into everything, right? um, Decreased appetite, persistent symptom, not resolving with the typical treatment. This can go with every condition that you come across. For dyspepsia with dyspepsia with iron deficiency anemia, dyspepsia not resolving with the normal medications. So dyspepsia in elderlies. So this can also point you towards some suspicious thing going on. So we would expect you to actually document this dyspepsia. All right. Lower back pain. Lower back pain is so common and so benign, but when this lower back pain becomes problematic, if it is associated with weight loss, if it is not resolving, if the patient has severe back pain, if the patient has a history of malignancy or things like that. So you can go up, and the list is not exhaustive. These are some of the examples to activate you that every topic has some danger signs attached to it. And whenever there is a danger sign, you should know that, okay, this is a referral criteria, or this is a time for us to refer the patient, not to treat him anymore in the primary healthcare setup. So this is your upper limit of every topic, whatever topic you are preparing, whatever topic you are reading. Developmental milestones. There are some developmental milestones, danger signs. If you go through the list of developmental milestones, I recommend you to go through the Oxford GP only. Don't go to the Nelson's or the other textbook of the pediatrics. It's going to be very extensive and you will lost in that way. So try to memorize these developmental danger signs, for which, like for a 1-year-old child, if this does not achieve, you should refer the child, or there is some other thing going on, so some developmental delays going on, so on and so forth. I'm not going to discuss here the specific danger signs. You can go and look up that in the Oxford GP. What are the danger signs, at which level, what is the upper cutoff, that beyond that you need a referral to know what is the cause of this developmental delay. Maybe hypothyroidism, maybe CP child, and things like that. Ear pain. Even the ear pain has some danger signs. If the ear pain is not resolving, if it has weight loss, if it is associated with weight loss, if it is associated with if it is not responding with the typical antibiotics. So probably these are the some of the general danger signs, and so on and so forth. So I've given you some of the examples of referrals and or danger signs, and so that you can have an idea whenever you are preparing a lecture or giving a lecture, you should be aware of how you are going to deal these problems. Okay, so that's about danger signs. Any question regarding that?
No, doctor, it's clear. Thank you.
Doctor, have we